Hello and welcome. I'm Patty Tingle, your host, and you are watching Mac Moment. In our show today, we're going to be covering a number of different topics, but we're changing up just a little bit. We want to bring you some real-life examples of items that you might be able to use, recipes that you might be able to incorporate in your daily living, as well as fitness exercises. So throughout the day's show, you'll be seeing some of these activities. We also have joining us in our studio Michelle Parker. Michelle Parker is the program coordinator for the SHIP program. That's the State Health Insurance Program at MAC. Michelle's role there is to help people who are approaching age 65 to understand how to work with Medicare, how to make applications, how to understand Medicare Advantage plans, and then also to explore and help people to learn about scams that may be going on. So you'll be learning more about these things in today's show. But before we talk to Michelle, let's go and visit with Janet, the Gadget Lady.
Hi, I'm Janet, the Gadget Lady at the Mac Center here in Salisbury, Maryland.
She's Janet, the Gadget Lady.
So here for our little minute on gadgets, I brought a no-cut glove. But why would we want something like that? Well, if you have diabetes and your skin is very fragile, or you have someone who just has some dexterity issues and they have often cut themselves using the dreaded knife or the dreaded potato peeler, so they quit making fresh veggies, no more tomatoes, no more cucumbers because they've cut themselves. Well, here's a nice solution. You can buy what's called a no-cut glove. You put it on your non-dominant hand. You put your tomato there, your cucumber, your potato, and now you peel it, and because it has a Kelvar type product inside of it, you're not going to cut yourself. No matter how sharp the knife or how hard it is, now you can cut without cutting yourself. And you can buy these at some local stores, and the best place to go is to where they sell fishing supplies. Yeah, fishing supplies. You get a fillet glove that fishermen use, so you can find them in lots of places. The colors aren't awfully pretty, but they really work well. So, if you're having problems with a knife or the potato peeler because you're cutting yourself, get yourself a no-cut glove. So that's the tip for today, but if you have questions, comments, please call us at Mac Center or email us or stop by and ask for the Gadget Lady. So, bye for now.
Welcome back to a Mac Moment. I'm Patty Tingle, your host, and joining me today in the studio is Michelle Parker. Michelle Parker is the program coordinator for the SHIP program. That's the State Health Insurance Program. Welcome, Michelle.
Hi, Patty. Thank you for having me.
So we're here to talk today just past the open enrollment phase. Glad to have that behind us. Moving forward now to a new phase with Medicare Advantage.
Yeah.
Explain that.
Okay, so right now between January 1st and March 31st, it is your Medicare Advantage open enrollment period. So what that means is that you can elect to make changes, maybe from an HMO to a PPO or to a plus plan. Locally in our area on the lower 3 counties of the Eastern Shore, Worcester, Somerset, and Wicomico, it's the Johns Hopkins Advantage plan that's being offered through the HMO, PPO, or plus plan. So if you have a Medicare Advantage plan and you want to make changes, or maybe you don't like it, you want to come out of it, now's the time to do it. So you want to definitely go ahead and give us a call so we can set you up on an appointment to bring you in and review maybe if that may be the best choice for you or give you other options.
Okay, we flew through some initials there, so translate for me a little bit. What's the difference between the HMO, the PPO, and Medicare Advantage?
Okay, yeah, I get that question a lot. So your HMO is a more of a in-network, don't need you need a referral type of plan. You have to see those assigned doctors stay in that network. The PPO gives you a percentage of cost that is covered otherwise for maybe a physician that's out of network. So you might pay 40% if you go to a physician out of network, but it gives you the option of seeing other doctors that are not in that network.
Okay, and are both of those considered Medicare Advantage plans, or is Medicare Advantage something different?
Right. Medicare Advantage is actually identified as Part C under Medicare. A lot of folks confuse that, but a Medicare Advantage is an all-in-one plan. Your drug plan is included, your prescription drug plan, and it offers a little bit of vision, a little bit of dental, and you have set co-pays as opposed to original Medicare, where a percentage comes into play.
Okay, so explain the difference now between the open enrollment phase, which we just had, and this Medicare enrollment phase.
Okay, so Part D open enrollment, you'll hear, that was October 15th through December 7th, where folks could shop their Medicare drug plans to find out if, there's a more economic plan for them, or perhaps, I'm sorry, that phone just went off.
Let's start from, what was the question again?
Okay,
Sorry.
so explain the difference between the open enrollment period that we just had and this Medicare Advantage enrollment period.
Okay. The Medicare Advantage plan, open enrollment, that plan is an all-in-one. So that's your main medical as well as your prescription drug coverage. October 15th through December 7th is your Medicare prescription drug coverage open enrollment. Most of our folks locally are under original Medicare, but that is a time for you to shop your prescription drug plans, to review any medications you may be on, and you can do that annually to obviously get the best rate you can in a otherwise competitive market.
Can you tell me, if I'm shopping, why would I consider a Medicare Advantage plan?
A Medicare Advantage plan is designed for folks that are generally healthy. They're also, if you don't travel a whole lot, it's good for you because if you go out of network, you don't get that coverage. So if you tend to stay in one place, that might be a good option for you. I know also Cambridge was under the University of Maryland Advantage plan. They no longer have that option. Actually, Dorchester County has no option. They have to be in original Medicare. So unfortunately, Johns Hopkins only covers the lower 3 counties. So, hopefully there'll be some expansion next year. So they'll have a wider variety of choices. I mean, they should be able to choose which plan they want to be in. And Advantage plans are also good for folks that are under 65, who often can't get a supplemental plan because they're too much money, or they won't sell them an Advantage plan because of their age. So it's a good option for those folks who need that coverage.
Okay, so if I'm looking for coverage, this is Part C. This is the Medicare Advantage plan. May not understand exactly everything. How do you help?
Okay, that's a good question. So people will call me all the time and they'll say, I'm turning 65. I have all these decisions. I'm getting all this mail. I don't know what to do. And they'll be in an absolute panic. And they're getting phone calls. Anybody that's turned 65 has received a bunch of mail and a bunch of solicitation phone calls of trying to sign up for different plans. We at MAC offer a non-biased view of what the insurance is, what it covers, how it directly covers you, and also, maybe what the best plan for you may be. Medicare is not a one-size-fits-all. So unfortunately, it's more of a person specific. So a lot of times people say, well, my neighbor's doing this or they're doing this, but they're in a whole different, health situation or financial situation. And so theirs is going to look a whole lot different than yours. So I try to tell people, at least give us a call. Let us take a look at it, hear what I have to say, because again, it's non-biased. I'm going to teach you about Medicare because let's face it, nobody wants to know about Medicare. And if they do, don't operate heavy machinery afterwards because we get it. So I just break it down in a way that folks can maybe grab onto it a little easier, and be comfortable with the decisions they make, because a lot of times they make these decisions and they don't realize they don't get a second chance, especially when it comes to maybe getting supplemental plans. So 65 is a very important time because most folks start Medicare at 65.
So you made reference earlier, if I'm not satisfied with my Medicare Advantage plan that I select in this period 2019, I would have to wait until this period 2020 to change?
Correct.
Okay, so I have to live with whatever I select for at least a year.
Correct.
Okay, so you mentioned I can call you. What is the number that I can call you?
And the number here for Mac is 410-742-0505, and extension 114 will get you directly to the SHIP department.
And if I happen to be at MAC or near MAC, can I stop in to visit? Do I need an appointment?
We encourage you to get an appointment due to the high volume, and just making sure that you get the dedicated time that you need. Because let's face it, it's hard to sit and tell you everything in 10 minutes and expect you to remember it. So I like to make appointments where I can sit down, give you the individualized attention you need so that I can grab the whole picture and best direct you.
Okay, you were mentioning earlier that things come in the mail, people are getting phone calls, and scams are on the rise. We heard recently about Social Security called and they wanted you to confirm the Social Security number over the phone.
Mm-hmm.
What do you say about this?
I will tell you that Social Security does not usually call you. So unless you've been dealing with them on a prior issue more recently, they're not going to call you. They're going to send you a letter. So if they want you to send money, gift cards, anything like that, it's false. It's a scam. If you feel it's not right, don't go with it, because our seniors are getting scammed way too much. And there's actually people that can spoof or change the number to look just like Social Security's number. So if you look up the number and you see you'll see the same number and you'll say, oh, okay, that must be right. It's not, because they can spoof those numbers. So please be careful, be diligent about what you get. When you get your Medicare summary notices, look them over. You get them every quarter. They come from the Centers of Medicare and Medicaid, and so if you look at them, it'll tell you all the stuff that Medicare has paid for you for the last 3 months. And that's important, because if there's a service that you didn't receive, we need to let them know about it.
So that's what I'm looking for when I receive those quarterly statements, is I'm looking for names maybe I don't recognize, or I'm looking for the service I don't recognize.
Either or. If there's a service, sometimes the doctors will put through services that maybe we're not aware of what they're called, but you'll have this test or that test. But, mainly, did you see that doctor? And was the service covered? And, what is the possibility you may be billed? So, just taking a look and seeing if you actually, did see that doctor on that day. It's as easy as that. Or, even with your prescription drug coverage, you get statements from that company every quarter. You want to look at those and make sure that the prescriptions are getting filled at the amount that you're filling them at. So when we get these statements and we see something is not accurate, what do we do? Contact me. Yes, you want to contact me because I can help you identify, or we can look further into what that service was. We forget things, I forget things. It happens, we're human, but we want to make sure that we do our due diligence to make sure, things are rectified and that is a service that you had received at one point or another. And if not, then we can escalate it to the proper authorities.
So you can help me with these Medicare quarterly statements, but what about a bill that I get in the mail direct from a provider or an ambulance service, and I never used either one? Can you help me with those?
Absolutely. You want to give me a call and I can go through the channels necessary to make sure that we get that corrected, or to identify what is really going on and where it's being billed from. So a little detective work, but definitely can get it done. But we need to know about it. We can't do anything if we don't know these things are being improperly billed, or, more quantity is being billed than is what's being given.
Sure.
So those are things you want to look for, definitely.
Okay, so a lot of this is about paying attention, paying attention to what comes in the mail, paying attention to the names of the doctors who are involved in my care. If I have a hospitalization, what doctors were there who were offering advice or review or evaluation assessment testing, those sorts of things. And if the dates on my statement are for a hospital period, then that may be okay if I don't recognize the name. But if it's a different date completely, that may be a real sign that something's off.
Definitely.
Okay.
Definitely.
So there are things to keep in mind when we're talking about Medicare, and there's a tracking, and there's paying attention to open enrollment periods, and I'm not Medicare age, but in the next few months, if I were to turn 65, I don't really understand what would be required of me related to Medicare. Excuse me. So how do you help people who are approaching 65?
Yes. So what I've been thinking about, and I want to try to start doing, and we are going to start doing, is we're going to start having classes, and it's going to be, aging in at 65 or turning 65 and going on Medicare. These classes are going to cover things from, what do I need to do the 3 months before I turn 65, which starts your initial enrollment period? What do I need to look for? What do I need to sign up for? These are going to all be items that are covered in these classes so that you have a better understanding and you're more prepared for when the telemarketers start to call, or when you receive solicitations in the mail for a supplemental plan F or G. And you're like, I don't even know what these are. So, these are going to help you to filter through and really identify what you need versus what is just trying to be solicited.
So you're going to be offering classes. Are you going to be offering classes at MAC?
Yes, we're going to offer free classes at MAC. We're going to offer a daytime and an evening class for our working seniors too, so that you'll have an opportunity. You can look for them towards the end of March to start. I'm looking to start them at the end of March, continuing at least monthly throughout the end of the year. That way, if you miss one, you can sign up for one later. And it'll be covering similar content, because everybody's age is into 65, so it's important that we keep the ongoing education there.
So it sounds like this is part of your planning process now before you launch these classes. Any consideration to taking these classes into the community, say Somerset County, Crisfield, Princess Anne, or into Dorchester County, more localized, or will they only be offered at MAC?
To start, we'll be offering them at MAC, but I do plan on replicating the services just like we do with open enrollment. We tend to visit other libraries in other counties so that our presence is known. So I would like to also replicate those in the other 3 counties other than Wycomico, so that the folks with transportation issues are not left out, or they just can't make it that far. So
Sure.
Absolutely, those efforts will be duplicated in those counties.
So how do I learn more about your classes?
You want to keep checking the MAC website. Keep checking the MAC website. You're welcome to call. I would probably wait till at least the beginning of March so we can get the finished touches on the plan and get it all published. But we will be publishing it through our Facebook, our local newspaper alliances and things like that. So our PR department does a great job at getting the word out where we're going to be and when we're going to be there. So definitely keep an eye out. They'll be coming out, and if you ever need, anybody needs anything, or you have a doubt, or call, because the only stupid question is the one not asked.
Good information, Michelle. We're coming to a close. Any final thoughts?
Just when you're turning 65, do not sign up for anything until you've talked with somebody. I get a lot of folks that, maybe didn't make the right decision, or they jumped the gun, and then it's easier to talk about it and enroll than to go back and fix it later. So just be diligent and be mindful about what you're signing up for.
Thanks for being with us today, Michelle. A lot of good information. We really appreciate you today.
No problem. Thank you for having me, Patty.
And now here's Carla for our nutrition tips.
Hi, I'm Carla Beardsley from MEC, and today I have a nutrition tip for you. Many of us have heard that we should go to the grocery store and shop from the perimeter. This is because our healthiest foods are the whole foods that are around the perimeter of the store. They are the produce, the meat section, the dairy section. These are considered whole foods. They are not adulterated or processed. When we get into the center area, we find those foods that have had salts and sugars, and many of the foods are also with ingredients that can be considered preservatives. So what we know is that some of these foods are higher in salt, fat, and sugar than our bodies need. We've got the benefit now of a new food label on all of our foods so that we can tell much better what's in that food. The biggest joy is that it's written in bigger print, and the calories will jump out at you because they are bold and labeled with dark ink. So right away we can tell the number of calories per serving, and we can look down the label and we'll see many more bits of information. The new labels now contain different nutrients. They contain the vitamin D, the calcium, the potassium information, and also the iron nutrients, and this is different than was before. So again, we can compare foods using the label. We can, if we're not buying the whole foods, we might be able to choose those foods when we compare one salt level to another, that we are getting the lower version of that particular food product. Keep in mind that anytime we are getting a higher salt food or higher sugar food, the smaller portion would be the answer for getting less of that particular nutrient that we don't need. So this is your nutrition tip for today. Shop the perimeter of the store, and that way you can get the most nutrients in the wholesome foods. Remind yourself that the new food label will tell you what's on the products, and that information will give you not only the calories but also the vitamins and minerals that are in that food. And the best part about that is we can compare foods that of similar whatever we want. If it's cookie for cookie, why not get the one with the less sugar? Thank you, and see you next time.
So thank you, Carla. Wonderful tips. We look forward to trying those out. And if you put on a few extra pounds listening to Carla, because she has some very tasty tips, we now have Robbie who's going to tell you how to take those pounds off.
So welcome back to another fitness moment. My name is Robbie Chin. I'm the Health and Wellness Coordinator and one of your personal trainers at the MAC Center here in Salisbury, Maryland. Today what we're going to cover is a great shoulder prehab and rehab exercise. Again, before we do any exercises together, it's probably a good idea to ask your primary care physician or your physical therapist or a specialist that you've been seeing to make sure that the exercise is okay for you, and make sure you get their green light before we go ahead and do this together. So without further ado, all that you're going to need is a wall and yourself. So what I like to tell folks is to stand nice and straight up against the wall, stand as tall as they can, all right, and then send the shoulders back is the other part, okay? The next thing that we will do is bring your forearms like 90 degrees and put your elbows up against the wall. All right, from here, we'll just raise our arms flat to the sides. So the arms are nice and flat, the elbows are in shoulder height. And then from here, Again, keep the neck long, keep the shoulders out of the ears, all right? And then from here, you can either work straight up and down, keeping the elbows down and arms at 90 degrees, come straight flat. That works the medial delts, the sides of our shoulders. And then if you need a little bit more of a challenge to work the rotators, so the back of the shoulder, you can raise the back hands and knuckles and fingertips up towards the wall. So we can go from this flat position, rotating externally straight up. You should feel that in your upper back, right on the shoulder blades and the back of the shoulders. And then as far as the repetitions to do here, hitting even 8 or 10 at a time might be a little difficult, even for folks that have healthy shoulders. I know this one is a bit of a challenge, but if you can get rounds of 10 to 15 repetitions, doing about 3 sets of 10 to 15, that's a really great way to maintain some shoulder functionality, but also it's a really great way, those rotator cuffs, the muscles on the back of the shoulder, on the shoulder blade, and the back of the shoulder here. This is a really great way to bulletproof your shoulders, or if you're rehabbing from an injury, I'm sure they have you going through a certain protocol. So again, make sure that's all clear and you're okay for this one. This is a really great one as a shoulder warm-up. You can also just use it as a part of your main exercise or your workout, and hitting 10 to 15, going from flat to what we refer to as goalpost arms. It's a really great way to train your rotator cuffs. So again, thanks for tuning in to our fitness moment. Again, my name is Robbie Chin, your health and wellness coordinator and personal trainer here at the Mac Center in Salisbury. Feel free to reach out to us if you have any questions, or come and stop by and say hello. Thanks again for joining, and we'll see you next time.
Thank you for watching Mac Moments. I'm Patty Tingle, your host. We're so glad that you were able to join us. I hope some of the information we've shared with you today you'll find helpful. Please feel free to call us, visit our website, our Facebook, and our Twitter accounts to learn more about Mac and the activities that are going on. And if you have a topic or an issue, concern that you would like us to talk about on any of our upcoming segments, please feel free to email macinc.org, and you can use our general mailbox. It's info@macinc.org, and let us know what you have an interest in, and we'll attempt to research that topic and bring you more information in the upcoming months. Thank you again. We hope you have a wonderful day.